Hello everyone, I am Dr. Sahil Kapoor. Today we are going to discuss one of the most common emergency in ENT, that is nasal bleed or epistaxis. Epistaxis is classified as anterior nasal bleeding and posterior nasal bleeding. Anterior being more common, whereas posterior is less common. The difference between anterior nasal bleed and posterior nasal bleeding are: anterior nasal bleed is more common as compared to posterior. The anterior nasal bleed mostly occurs from the Little's area, whereas the posterior nasal bleed occurs from the Woodruff's plexus. Anterior nasal bleed is more common in children and young adults. Posterior nasal bleed occurs after the age of 40. The anterior nasal bleed is mainly caused due to trauma or by nasal mucosa dryness, and the posterior may be spontaneous, may be seen in hypertensive patients or patients suffering from atherosclerosis. The anterior nasal bleed is usually mild and can be controlled by local pressure or anterior pack. The posterior nasal bleed is more severe and requires hospitalization. Posterior nasal pack may be required. What is the etiology of epistaxis? There are multiple causes of epistaxis which can be divided into local, systemic, and idiopathic. Local causes include trauma, which may be due to fingernail or accidental trauma, infections like sinusitis, viral rhinitis, and diphtheria, etc. Foreign body may be non-living or living. The non-living foreign body usually leads to formation of a rhinolith, which in children presents as epistaxis, and living foreign bodies like maggots or leeches. Bleeding may be due to neoplasms of the nose like hemangioma, papilloma, juvenile angiofibroma, etc. It may be due to atmospheric changes like high altitude, extreme cold or hot climate, and may be due to deviated nasal septum. Systemic causes include coagulopathies, hypertension, cirrhosis, nephritis, COPD, etc.